As part of our obligations, we have 6 standards that we need to implement with regard to cultural diversity at Bendigo Health. So to do that, we've developed a cultural responsiveness plan from 2011 through to 2013. So that plan addresses 6 main standards, and I'm really wanting just to talk about 3 of those at this time. So one of them is about our organisational approach and what we do to demonstrate our approach to cultural diversity. So we have recently created a cultural diversity advisory role, which is due to start in July this year. So that the main role of that person is to oversee the implementation of the Cultural Responsiveness Plan with the Cultural Diversity Advisory Committee. And also, as part of that, Bendigo Health strategic plan is developing partnerships. So that focuses on relationship building and integration with service providers and the community. So that's just that focus from the top down. The second point that we need to talk about is accredited interpreters and usage of that at Bendigo Health. For this financial year, until the 20th of June, there were 414 accredited interpreter services requested. So that was a 100% increase on last year, which was 226. So we've had a huge increase. Basically, because obviously there are more people coming through our door who are needing those services, but also because more staff are becoming aware of the availability of the services and the ease of which they can be provided. Of those 414 requests, 410 were provided. There are a few reasons why they can't be provided, and one that is sometimes the agency just can't provide that particular service at that particular time that's required. Or in one instance, Bendigo Health requested the service a little late, and so the timing wasn't good for the agency to provide that service. But overall, that was over 99% of people received a service. On-call interpreter and translation agency provides that service. So that's a service that's based in Melbourne. It's an agency for interpreters. Some of our interpreters are local, but generally speaking, most of them come from Melbourne or other places. That's about how Bendigo Health seeks input from individual community members, community groups and service providers, including those people who have culturally and linguistically diverse backgrounds, so that it can plan, review and improve its services over time. So we have quite a few structures that support that. So one of those is the Bendigo Health Community Advisory Committee, and the other way is departments and units conduct service reviews of individual patients, clients and residents on a regular basis. Then of course there's individual complaints that often result in service improvements. Consumers are represented on lots of Bendigo Health committees, like the Quality Care Council, as I said, the Cultural Diversity Advisory Committee, Health Promotion Committee and the Aboriginal Advisory Committee, so that's just a few. Inpatients are provided with opportunities to give feedback about their experience in acute and subacute areas via the Independent Victorian Satisfaction Monitor, and case management services and carer support services are planning client and carer forums this year. And most of the departments, especially psychiatric and rehabilitation services, have individual community or consumer groups or carer groups. So there's lots of ways we seek that feedback. I think we're actually pulling that information together in a more cohesive way, where we've had all these things happening in the past and they've gone the ways that they normally would, but this way we're actually overseeing all that input and where that's coming in. They're used in individual service planning, so if it was one of Bendigo Health services like case management services, then that individual service would use that feedback to feed into its own committees and its own quality structures and make some improvement depending on what that feedback was related to. Specifically around cultural diversity, we have Cultural Diversity Week is in March every year, and if possible, Bendigo Health does try to put on some staff awareness raising function. So this year we supported Harmony Day, and we had morning tea and things like that, just to raise the awareness of what service providers are out there to support people from different cultures, and what services are within Bendigo Health to support the inpatients or the people coming through our doors. The second event is NAIDOC Week, which is held in July every year, and I think this year we had morning teas, and again it's that staff awareness, consciousness raising around the needs of Aboriginal people when they come into a healthcare situation. Oh, I think Bendigo Health has been very proactive in seeing the need for someone to support staff and consumers across Bendigo Health with this role. And certainly it supports the liaison between other service providers like Bendigo Community Health Services, Loddon Campaspe Multicultural Services and so forth. So it gives that central point of contact, I suppose. Every staff member at Bendigo Health has an obligation to understand that there's a cultural responsiveness plan and how that might impact on them at their service level. So it's about the knowledge that those things are there. There are structures in place to support cultural diversity at Bendigo Health, and how they can use those structures to support the clients or the service providers.